Let's talk now, Dr. Dean Eggitt, GP and CEO of Doncaster's local medical committee. Lots to talk about this morning, Dean. Very good morning to you.
Good morning, Mike. It's been busy, hasn't it?
It has been, yeah. I mean, we had Keir Starmer last week saying his greatest achievement in office so far has been getting 3 million NHS appointments. You may have had quite a lot of those in your own surgery, but an awful lot of people saying to me, yeah, we've had loads of appointments, we just haven't seen anyone. They keep making appointments and cancelling them. And I know at least 5 times the number of people who get in touch with me is usually what is the real picture. And so many people say to me, oh yeah, we've had 5 different appointments for some procedure or other. We still haven't had the procedure.
Yeah, the waiting lists are crazy as usual. I think there's around 7 million patients waiting on the NHS at the moment, or around 6 million, but 7 million interactions that are needed. So some people have several things that need to be done. And we're being bombarded with these text messages and letters saying, do you still need your appointment? Do you really need it? And if you don't reply, then you're removed from the waiting list. So there's some inventive accounting going on to try and bring these waiting lists down, including using hospitals and clinics outside of the UK.
Well, this was the thing we discovered at the weekend. A number of people having procedures overseas has jumped by 42% in just 2 years. Places like Poland, Lithuania, the Czech Republic, routine operations, hip replacements, cataracts, some even complex cancer surgery, apparently.
That's right, and we've spoken about this on this programme before, where if you are waiting for quite a long time on the NHS, you can apply to have your routine procedure carried out abroad. There's around 31 countries where this is available. So if you've been waiting 18 weeks or longer, you can actually contact your local NHS and say, well, actually, do you mind if I travel and get it done quicker?
Right. So if you get told you can go and have your hip replacement done in Poland, does the NHS stump up the airfare as well? Do you have to pay that?
No, not quite. The NHS won't stump up the airfare, but they will pay for the treatment costs whilst you're abroad. So I think a lot of people might be tagging it on to a pleasant trip around their treatment. And why not? You know, if you're ill, it's quite nice to be in pleasant surroundings.
Well, that's true, I suppose so. Let's also talk this morning about the fat jab, because I was reading today in one of the papers that today's the day that NHS GPs can now give the fat jab out. Does that mean you're going to have a big surge of new claimants this morning sitting in the waiting room?
Well, I've already been told about the large number of patients who are trying to get through to GP surgeries this morning to try and get hold of the injection. So there's some good news and there's bad news in this. The good news is that, yes, the injection is available for those people who need help in losing weight. The bad news is actually it's not universally available across England. And there are some areas where you contact your GP practice and your GP is going to say no. Now, the rationale behind that, I should point out, is not your GP. So there's lots and lots of complicated factors around GPs prescribing. And in some areas, the GPs are not yet actually allowed to prescribe. And that's a local decision, not your GP's decision.
And is that based on what, the local health trust or something?
Yeah, so the local commissioning groups look at whether or not it's viable in terms of cost, or whether or not the services that wrap around it are there and present. So it's either, one, can we afford it, and two, are the services available that wrap around it? And in many areas, because it's been quite a rapid rollout, the services surrounding the injection are not available. But I've got a quick fix for the listeners here today, Mike.
Yes.
And that is something called right to choose. So if you contact your GP and the GP says, I'm sorry, it's not available for you, just go on the internet, Google right to choose weight loss injection, and you will find somebody across England who can prescribe it for you.
Oh, so you can have it prescribed even if you're not necessarily a patient of that particular doctor's?
Yeah, you'll become a patient of that group. It's not a GP practice. It's usually some other provider, some other company who works with the NHS to provide access for patients to the service. So you don't necessarily have to get it directly from your GP, because as we know, in England, patients have the right to choose.
Right, OK. Well, that's all very good to know. Thank you very much indeed. Dr. Dean Eggitt, have a good day. GP and CEO of Doncaster's local medical committee, of course.